provision of services. And this brings in the question in regards to the big players in this sector of e-health. What are they bringing on board? And at this particular moment, I'd like to invite Priscilla Muhir, who is the CEO of MyDawa. Priscilla, welcome to the show.
Thank you very much.
Good to see you.
Yes.
A lot happening in the e-health sector, which is very, very critical. It is a vibrant sector in Africa. We seem to be, as a country, we seem to be always ahead when it comes to technological adoption.
Yes.
Talk to me about MyDawa and leveraging on Kenyans' propensity to take up technology.
So allow me to introduce MyDawa. So MyDawa is the leading e-pharmacy in Kenya. However, of late, we have become more than just a pharmacy.
Okay.
We have telehealth capability. So in the event that you need to, you're feeling unwell and you need to speak to a doctor, you can come in, book a consultation, and then a prescription is written to you, and the medication is delivered to your home.
Okay.
So you only go to hospital because you need to go to hospital.
Okay.
And the event that you require a lab service, we have partnered with a couple of labs in Nairobi, for example, and lab tech is able to come to your house, pick up your sample, give the results back to us, and then write a prescription and then get the medication delivered to you. So ideally, what we're trying to do is to digitize the whole end-to-end healthcare journey.
That's quite interesting.
Yes, yes.
I mean, how is the customer reaction to this? Because health is very sensitive.
Yes,
it's very personal.
Yes.
Even people tend to choose doctors. So when you introduce this electronic element to it, end to end, how's been the market reaction to this?
MyDawa was launched in 2016. And the first few years we struggled a bit, and this was mainly because of regulation. We were a bit ahead of the regulation. So, for example, no one had ever done an e-pharmacy model before. So we had to work together with the regulators to come up with a policy that makes sense for both the customer and also the business. So yes, we did struggle at the first couple of years, but now, since COVID, actually COVID is the growth hack that we needed. Since COVID, we've seen an uptick in our services. And with regards to your question, it's true that people tend to have specific doctors they want to see. So what we have seen from the data is that most of the people coming to us for consultations, they're coming to us because they have a chronic disease and they want us to help them manage. So in between their specialist visits, ideally what they do is on a month-to-month basis, they are able to book a consultation with the doctor, share with them the readings of their, the remote monitoring they are doing, and then now we send medication to their homes. So we currently support the patient in their journey to as they are trying to manage their chronic diseases. So we've seen most of our consultations focusing more on the chronic diseases.
Oh, I see.
Yeah.
That. And one of the advantages of digitization, especially data is king in everything, even in health.
Yes.
And it can really take us a step ahead when it comes to the way we handle our healthcare system. We're talking about universal health coverage.
Yes.
And that aspect of data being utilized, for starters, for the benefit of the users. How critical is that, and where are we as a country, as an ecosystem, compared to maybe those who are leading globally?
I think we are not far off, in my opinion. I think we are actually doing a lot more, especially in Kenya, because, as you know, tech adoption is faster than most of the African countries. We thrive on data. We rely on data to make everyday decisions. For example, we are even able to detect fraud in the event that maybe we have a prescription fraud. For example, we see a particular drug coming from one particular doctor, and we can be able to look at the data and question what's going on there. So data is very important because we are able to make decisions and figure out what you need to do to grow, as well as help reduce the fraud cases we see in the industry, especially in the insurance industry.
Why is it critical in the insurance industry?
As you all know, you can take advantage of the payers. So in fact, we had a meeting yesterday, and one of the trends is what I'm talking about, where someone comes into the platform, has a fake prescription, they upload it, and then they get the drugs delivered to them, and they sell the drugs. So we are able to, with data, you're able to detect some of these patterns, and then we are able to curb before they extend.
Okay.
Yeah.
That's quite interesting.
Yes, it is.
Prevention of fraud.
Yes.
And it's been a case in point in the country for quite a number of days.
Yes.
Just the other week, we were looking into a lob or an orb, as they call it, and we were getting 7 Gs, you know.
What is that, WorldCoin or what?
WorldCoin,
Oh.
yeah, I remember
Yeah,
that.
yeah.
In regards to that excitement, there is an economic factor to it. And that brings in the question, when we adopt technology into our health sector, does it lower the cost of doing health, or is it an added element, an added layer to healthcare?
It does lower the cost. So just to give you an example, right now our current cost per consultation, given that we are able to centralize all the doctors into one place, and then you book a consultation, and the whole triage process that you see in hospitals is minimized, we find that the cost of consultation for us is about less than 100 shillings. That means we can pass this amazing cost to the customer. So you can easily charge 200 shillings per consultation. And being able to book in advance also helps us to plan better and optimize the clinicians in the office. So yes, it does help reduce costs. And when you think about delivery and technology, we are in a position where we're able to aggregate demand from the different people and then use that data or volume to go back to the manufacturers and tell them, we have a volume of 10,000 patients with diabetes, give us a discount, and we pass that discount back to the patient.
Oh, so there is power in numbers.
There is power in numbers.
You know, one of the challenges, even when I talk to my mom when she goes to the hospital, it's always, I'm told to go to this window, then I'm told to go to the other window, and they're always taking, you know, money in those specific windows. It seems to sort of amalgamate the whole system.
Yes.
So you're saying your focus is end to end.
Yes.
All right?
Yes.
You want to sort of overhaul the whole system.
Not really. I think we can't do away with the hospitals.
Yes.
I mean, right now, even as we have the telehealth facility or capability, we have a panel of referral hospitals we work with in the event we need to refer someone to a hospital, because we understand that there are challenges or there are limitations when it comes to telehealth. There's only so much you can do over our phone or on video. So in that event, we have to send a patient to our referral hospital. So it's not that we are trying to eliminate the hospital. It's
sort
not
of
possible.
complement.
It's complement. Only
Okay.
go to hospitals because you need to. So when you think about it, if we scales, we're going to reduce congestion in the hospital and the service levels will improve in the hospitals. So ideally, we are complementing what the hospitals are already doing. In fact, we are even able to do what we call a white label service. So for example, if a hospital is interested in going into a telehealth service, we can be able to provide that service on their behalf. And that helps them now become a digital focused hospital.
Okay.
Yeah.
That's kind of interesting. I really like that. In regards to the element of telehealth,
Yes.
and there is also e-health.
Yes.
There are all these,
Terms.
accurate terms, and somebody sitting at home and wondering, okay, what's the difference between when I talk about e-health and when I talk about telehealth? Does it vary? Do they mean the same thing? Because it's very easy, to throw jargons there.
It's true.
Yes, and maybe they have a difference.
So telehealth is mainly the consultation that you have, the online, the virtual consultation you have with the doctor, either through a call or a video. But e-health is digitizing the whole user journey from the consultation to prescription ordering to the delivery of the prescription. So e-health is digitizing the whole journey as opposed to telehealth, which focuses only on the consultation.
Oh,
yes,
I
that's
see
the
that.
difference. Yeah.
And another thing, because there's been so many cases of misdiagnosis
Yes.
in this country, just around my group of friends. Oh, my mom went and she was given this medicine and it wasn't for that specific purpose. And it's becoming quite a concern. I don't know whether inculcation of technology into our healthcare system will deal with some of these challenges that we are facing currently. Especially, let's start with misdiagnosis. With the trail, can we be able to sort of deal with this issue?
Yes, I think so. Although it's not something that we currently do at MyDawa. As I explained, telehealth has its own limitations, so we're not able to diagnose a patient. With telehealth, we have to send them to a hospital to be properly diagnosed.
Yes.
But yes, I believe that, let me give you a classic example of something I've had that's about to happen or will happen or is happening. I'm not sure. But using data points, we can be able to accurately diagnose, like not diagnose, but tell the results of a scan of, for example, a head CT scan or a fracture or whatever it is, the x-rays basically. So using different data points, you're able to come up with, like using multiple data points, you're able to come up with a diagnosis. However, I'm not sure about that technology, so I can't comment much about it. Yes. But yes, I believe there's opportunity to improve on the misdiagnosis.
Definitely. Yeah. And in the value chain, when technology kicks in, it is sort of a double-edged sword.
Yeah.
Because it upsets so many people on one side, and on the other side, it creates so many opportunities. In regards to the change that we are going to see as more adoption into technology, into our health further, who are the losers and who are the winners?
Okay. Let me remind you of the Uber situation, or the digital taxi apps. When they came in, there was a bit of resistance from the then current taxi drivers. But with time, what did? They had to join the platform. So I think disruption is here to stay. I don't think there's anything anyone can do to stop disruption. I think the best thing would be, how do you set yourself up to take advantage of those opportunities that the digital transformation presents. So I don't think we should see ourselves as competitors. We should see ourselves as, how do we work together to improve the situation in the country.
Is it time for me to go back to school and learn a little bit of coding here and there?
No, you don't have to.
Opportunities? What are the opportunities that lie with introduction of tech into healthcare?
Well, you don't have to go to school to code. I think, for example, I am a food scientist by profession. I did that in campus, but I've learned on the job, keep up with the trends, etc. So I think it's a matter of making sure you're on top of what's happening, making sure if there are any short courses or programs or conferences, you're attending them, getting to know what's going on. I think that can help you if you want to join our sector to keep up.
Yeah. Definitely. Yeah. And even as we talk about tech and the value chain, with opportunities, majority of businesses, and I'm very passionate about MSMEs and how they can position themselves and take advantage of the changes that are happening. There might be somebody who's operating a micro or a small business in regards to maybe medical equipment. They've gone into that. Is it going to conferences again, or how now do they position themselves to this change so that it favors them and their business?
So just also to talk about digitization, I don't believe we can 100% digitize every business process.
Yes.
It's a hybrid of both. Just to give you an example, right now, as much as we are an e-health, we have a physical pharmacy in Mombasa. So with regards to your particular question, if someone is interested in figuring out how to take advantage, I would take time to understand the user journey and understand what points can I digitize to make it easy for the customer to access my service. So I don't think you can do 100% digitization, but by understanding the user journey and understanding where you can improve efficiencies by digitizing, now by doing that, you should be able to improve your business.
Definitely. Yeah. And before we go for break, when you come back, we'll be talking about the financing aspects of it.
Okay.
Because a lot of players come with very innovative ideas. They wonder where the money will come and how will I expand, and not only be in Kenya, but across that. But there was research that I've just gone through before, I invited you, and they were talking about, we have so many digital health interventions in sub-Saharan Africa. But majority of them, either they're doing similar things, and you can say, the field is for everyone. You come and play better than the other one. But that aspect of data, like majority of them, they are very critical on data mining. And that from a medic's perspective or from a monetary perspective, you just read my data. It doesn't feel okay. So talk to me about this avalanche of DHIs and maybe how do you set yourself apart?
Okay. So I think you're referring to data privacy?
Yes, data privacy, definitely.
So we have governing law around that, so we are compliant as MyDawa. And then we currently have an EMR system that we're using to collect patient information, and we are hyper compliant. We make sure that the data for the patients is solid and safe. This is because, as you understand, it's important to make sure you keep that data safe because there are safety concerns around sharing of data. So we are hyper compliant, and we constantly make sure we are improving how we work to make sure the data is very well protected. Right. But there's a governing law around that, and we are hyper compliant, and every year we renew our data protection license.
Definitely.
Yeah.
So I want to take a short break right here on Business Today. When you come back, we'll talk about funding, because MyDawa, they've just had an injection of $20 million. And somebody has a brilliant idea, asking themselves, if I come to the market with this idea, how do I get the financing that I need? And how do I scale? That conversation after the short break. Stay tuned.